This is the Ministry of Health's Week in Review. Journey with us as we reflect on the activities of this past week. On Friday, April 12th, the Ministry of Health launched the Global Strategy for Cervical Cancer Elimination at the Pegasus Corporate Suites. Through this initiative, the ministry aims to screen 70% of women ages 21 to 65 regularly and provide follow-up care for women of all ages to detect precancerous changes early, ensuring timely treatment. While increasing vaccination coverage up to 90% remains a major goal for girls aged 9 to 15 years, vaccination also extends to older girls and women aged between 16 and 45 years. During his featured address, Minister Dr. Frank Anthony said that the ministry aimed to create a comprehensive program focusing on prevention and treatment.
So if we start with prevention, we all know that HPV vaccination can help us to prevent cervical cancer. And while this was introduced around 2010 to 2011, we had various challenges, as was pointed out by Dr. Hamilton, in terms of the coverage of HPV vaccination. What we want to do now is to make sure that we increase that coverage so that we can get to 90%. For girls between 9 to 15. But we also want to make sure that we target boys as well, because HPV can also affect boys, and we can see various types of cancers in boys, so we're not leaving them out.
The Health Ministry also hopes to strengthen healthcare infrastructure to ensure that all women have access to high-quality cervical cancer prevention and treatment services, while boosting awareness and education about cervical cancer prevention and the importance of regular screening. On Monday, the PALMS Rehabilitation Department kicked off a 5-day neurological rehab workshop with lecturer and specialist physiotherapist Amy Sauster of the University of Plymouth School of Health Professions. This workshop, which was held at the Ministry of Labor, aimed to provide clinical and leadership training for 44 physiotherapists caring for patients with complex conditions. Director of Rehabilitation and Disability Services, Dr. Aryan Mangar, said that the workshop will equip the participants with the necessary skills to improve the quality of care provided to patients while enabling them to return to daily activities with a good quality of life. Additionally, the Global Fund Country Coordinating Mechanism held a session for all stakeholders working in the areas of HIV/AIDS and tuberculosis to the National Dialogue and Consultation for the Development of a funding request that will be submitted to the Global Fund on April 29, 2024. HIV/AIDS Tuberculosis Program Country Dialogue is an open, inclusive, participatory process that includes implementers from the public sector, the private sector, civil society, academia, and networks of key affected populations. This includes women organizations, people most vulnerable based on the epidemiological context, including people living with the disease, bilateral, multilateral, and technical partners, and other stakeholders. While commending the stakeholders for their invaluable contribution to the meeting, Dr. Anthony had this to say.
That consultant is with us today, Mr. Nicholas Prasad, and he has produced a document which we submitted to UNAIDS, to Global Fund, and they came back with a set of comments, and so he is now taking those comments into consideration. And so this morning's event is for us to go through that and to see how we can further tighten up the proposal so that when it goes back to Global Fund, it can gain acceptance so that we can move this process along.
This has brought us to the end of this week in review. I urge you, our women, to take your health in hand. Let's unite in the fight against cervical cancer and work towards a future where no woman in Guyana has to suffer for this preventable disease. Stay tuned to the Ministry of Health's Facebook page for all your health information. Until next time, stay well.